Hi everyone, welcome to researchmd.com. We got another great presentation. Today's scientific analysis. ResearchMD always brings science to you. All our recommendation, all our analysis purely based on science. Otherwise, we will not go through it, okay? So today's topic is about amyotrophic lateral sclerosis and the role of omega-3 fatty acid in prevention of having amyotrophic lateral sclerosis. And there are two types of omega-3 fatty acid, which we're going to plant-based and fish-based. Which one is better? That's our question today. Again, my name is Pramil, Cheriyath. I'm a program director, internal medicine residency program, transitional residency program. I also teach medical students and medical residents, and I'm also director of research and assistant professor of medicine to major universities. So let's get into our subject. So what is amyotrophic lateral sclerosis? The word, look at the meaning. Amyotrophic means without nourishment to the muscle. Lateral means to the side, and the sclerosis means thickening of the hardening nature of the spinal cord, okay? So it's a disease of the muscles, kind of affect the upper motor neuron lesions around the brain and the lower motor neuron lesions, okay? What is the pathophysiology? How does somebody get amyotrophic? There's a big role to play about this protein called the TDP314, okay? What happens is it has a part of genetic. There's like a mutation of the TRDP gene. It can affect the TDP43, and it can cause like accumulation of TDP43. It's damaging to the neuronal system, okay? And then it's also something called a protein degradation pathway. You got two, one, an ubiquitin, and you got the autophage lysosome pathway, and then defect in that cause accumulation of, again, TDP43 protein. Now, when you talk about omega-3 fatty acid, in the previous presentation, we did say there is a role of omega-3 fatty acid in preventing amyotrophic lateral sclerosis, okay? So what is omega-3 fatty acid? It's a polyunsaturated fatty acid, and it's anti-inflammatory properties, also antioxidant properties also. So mainly, anytime we think about omega-3 fatty acid, we always automatically think fish oil. That's not the case, okay? You got two parts. One is a plant-based omega-3 fatty acid, and the other one is a fish-based omega-3 fatty acid. So in the omega-3 fatty acid, there is something called alpha-linolenic acid, which is ALA. That is the one, the plant-based, okay? Flaxseed, canola oil, chia seeds, walnut, hemp seeds, and soybeans, you can find it. And then you look at the other side of omega-3 fatty acid, where the fish oil supplement is. That's where you find this DHA and EPA, okay, which is decoxyhexanoic acid and icosanopentoic acid. So today our job is to compare which one is better to prevent amyotrophic lateral sclerosis. So studies have shown omega-3 has neuroprotective effect, can protect the brain, right? So we found this great study. So we just kind of go through that study and see, the study title is Dietary 3 polyunsaturated omega-3 fatty acid and the risk of amyotrophic lateral sclerosis. A biggest prospective study. There's like more than 1 million participants. Combined like 5 big cohorts, okay? And if you look at the results carefully, you can see clearly, right? Which one is superior, the ALA or plant-based omega-3 fatty acid. The benefits are much more compared to the omega-3 fatty acid based on the fish-based omega-3 fatty acid. So the relative risk and the confidence interval is given there. So results are taking a plant-based omega-3 fatty acid as a low relative risk of developing amyotrophic lateral sclerosis. So in conclusion, based on this largest study, more than 1 million people, taking a plant-based omega-3 acid when compared to the fish-based is better than to prevent the delay of the onset of amyotrophic lateral sclerosis. It's clearly shown that plant-based ALA omega-3 fatty acid, which is found in chia seeds, and we talked about they're also found in the canola oil, mainly the flax seeds. You can that is found, a lot of them, okay? Again, so our conclusion is based on this study, the plant-based omega-3 fatty acid is superior to the fish-based omega-3 fatty acid in the prevention of developing amyotrophic lateral sclerosis. Thank you so much for watching our channel.